So yeah, as my mum said, I was diagnosed in 1999 when I was 2 years old, and I was put on mixed insulin and then MDI, and then when I was 11, I moved onto a pump, and so I was the first person on a pump in my clinic, and my mum and I decided that it was best that we moved to a clinic with more pump experience. So that's what I'm here to talk about today, how the old clinic and the new clinic differed, and how I felt empowered by those differences. Right. So the first point to make is that my new clinic had a separate clinic and waiting area for 11 years and up. And the old clinic was great for little children. It had slides and games, but because this new clinic had this separate area, that made sure that the 11-year-olds who feel that they're at an intermediate age aren't lumped in with little children. And it was very nice to see people of my age there in that area and feel that I was, growing up and taking more control of my care and I was becoming more mature. So the second point to make is that I was asked to upload tech data rather than having it done for me. That's like insulin pumps on Diasend. I have had previous experiences where staff have taken my insulin pump from me to upload it, and it just made me a bit nervous and a bit patronised because that's my vital medical equipment, and it was also assumed that I wouldn't be able to upload it myself, when in actuality the member had to come back and ask me how to do it because he didn't have a clue what he was doing. So, a pre-appointment form had a box for any of my queries. This was really important to me because it gave me time to formulate questions that I had for my clinician or my DSN, and it meant that my questions weren't forgotten because they were written down. But also, it made me feel that they were relevant because they were put on the same standing as my basal rates and my diabetes data that was also put on the form. So getting into actually going into clinic to see my clinician made a point of addressing me directly, and he also wanted to be on a first name basis, which empowered me specifically because he was often preferencing my response over my mum's, even though she was in the clinic with me. But that made me feel that my opinion was just as valid as hers. He wanted to know what I felt about whatever it was we were talking about, even if my understanding wasn't quite as good as my mum's. The first name basis thing is it seems small, but it created an equality in our understanding of my specific care, which is really important to the patient and not necessarily felt by them. He often began with a 10-minute session for the non-diabetes topics, so I think this has been mentioned by Deborah and possibly by a couple of other people. And that made me feel accepted. It reassured me, and he often made relevant suggestions to things that were going on in my life that were stressing me out and were affecting my care. And he really drove home the idea that sometimes my care is going to be worse because of other things going on in my life, and that's not necessarily my fault. It's just going to happen. I was given the option on whether I wanted to be referred to a dietitian, a psychologist, or a DSN, as opposed to having them all in the room, which I know has been mentioned again. But in my paediatric clinic, all of those people were there, and that was very intimidating and unhelpful for me because I couldn't speak to any particular one person, especially because I felt the others were listening, which was poignant with the psychologist because it's very hard for a child to say that they want emotional well-being or psychological help if they're feeling that three other adults are listening, in cases where they don't really want to talk to their parents about whatever's bothering them, and so it didn't really work from that perspective. My clinician allowed me to disagree with him, so we had a long discussion about the use of dual wave or combo bolusing with my insulin pump, and I was saying to him that the effect I'd witnessed and the effect my mum had seen, that it wasn't working for me specifically, and so he said, well, I trust your judgment, and I'm going to allow you to make your own decisions about this. And that felt very nice because it should be him suggesting rather than him giving me instruction. He was relentlessly positive. So every time I put myself down, for example, I wasn't taking my insulin on time, or I wasn't taking it at all when I was eating because I was forgetting, he was mentioning the fact that I was reacting quickly to that, that I was often checking my blood sugar as soon as I knew it was going high. He would catch me out doing the right thing. Okay, so this is about after clinic appointments, really. He encouraged me to be involved in hospital focus groups and meet other young people. And, you know, as a patient, I love the opportunity to meet other young people. And he gave me the opportunity to do that. That was very empowering. You know, it does what it says on the tin. I got to have my say. There were examples where I got to be involved in the running of the hospital, which was amazing. It was a great chance to discuss with other patients what they wanted out of the hospital and really be involved in the infrastructure. The hospital offered education days, which he encouraged me to be a part in. And so he always explained these education days very clearly. He'd often have PDFs, or he'd send me an email about what they were about. And he wanted me to stay educated, even though he assumed that I, you know, obviously knew a lot about my personal care. But there's always new things to learn. I went on a Daphne course a couple of months ago, you know, from having the condition for 17 years, and I was still learning new things. If I had science questions, he listened, researched, and followed up. So the best example I can think of this in my life was I hated having my annual blood review done, to the point where I was like almost collapsing to have it done, you know, just one of those body instinct fear kind of things. And instead of belittling me or saying that, you know, lump it, you have to have it anyway, he went away and did research for the proof of why the annual blood review was being done, especially the thyroid check. And he came back and he explained to me that this is why they were doing it. And in some ways that made me feel better about the whole situation, because I was able to understand why the hospital needed to do it, which was empowering because he was providing me again with information and education. In a final twist of irony, I actually have low thyroid now, so I guess it was good to have all those annual blood reviews in the end. I often came away from clinic feeling that he had a lot of respect for my judgment. I felt I could take care of myself when I left clinic, and that the clinic appointment had been succinct and engaging, and it felt much shorter than the old clinic appointments I'd been to in my paediatric clinic, because there wasn't a lot of waffle. The doctor hadn't gone through, you know, maths or things that I already knew or my mum had already worked out. He just respected me to be able to be independent and take care of myself. And so a final point to make is he'd write down notes to remember me, so there was continuity. You know, if there were interesting things going on in my life, he was able to read about them and like ask me about them next time, which was really nice for me, because I do know what it's like to be forgotten over and over again by a clinician. But yeah, that's my final say on everything. And if I can talk a little bit about my HbA1c, with my old clinic, it was mostly over 9 and never under 8. And since having felt that I can take care of myself and I'm empowered, it's never been over 9, and it's mostly under 8. Thank you very much.